Having babies. It's something Americans had been doing less and less of until last year. For 7 straight years, the birth rate, or births per 100,000 population, had been declining from a high of 18.4 in 1970 to a low of 14.6 in 1976. But provisional figures released by the Department of Census show the 1977 birth rate at 15.3, possibly signaling the start of another baby boom. And if it is a boom that can bust the pocketbooks of the unprepared and burst the dreams of the uninformed. Babies are beautiful, but having them costs a lot of money, more than many young couples can imagine. And if you're thinking that insurance will foot most of the bill, you're wrong.
Traditionally, Bob, obstetrical service insurance has been very poor compared to regular medical surgical insurance. Of the typical average routine non-complicated delivery, I would say that approximately 25% of the bill is covered by insurance.
And that's just for the hospital bill, which for an uncomplicated delivery, including a prepayment discount, is about $850. A typical obstetrician's bill for a normal delivery, including prenatal care, is another $850. The hypothetical total, $1,700. According to a recent survey conducted by Baptist Hospital, average maternity insurance pays a total of only $200. Of course, not all deliveries are uncomplicated. Figure about double the charges for a cesarean section where the baby is removed surgically. With other complications, general medical charges after the birth can be astronomical, even when 80% is covered by major medical insurance.
With complications, if a baby has complications, you can have a rather prolonged length of stay. You might require intensive nursing care for a prolonged period of time, and you might have a bill in the range of $10,000 or $20,000. It goes up very quickly. I think if you have a serious complication for either the mother, but more importantly the baby, the consequences can be financially disastrous.
Experts agree that a couple contemplating pregnancy should be aware of possible complications and, most importantly, should be sure they have maternity insurance before getting pregnant. Tomorrow night, the increasing popularity of midwives. Bob Mayer, Channel 4 News. While most pregnant women utilize the services of obstetricians both for prenatal care and delivery, there is a medically acceptable alternative. Midwives have been delivering babies since biblical times and, in fact, are mentioned during the time of Moses. Nurse midwife programs like this one at the University of Miami Jackson Memorial Medical Center are springing up around the country. Here, certified nurse midwives hold clinics in which they examine and advise patients during pregnancy.
Can you induce the labor do you only do that if you have to?
Yes, if we have to. Right now, you are not that past due that we have to get that baby out. Absolutely today, all right? There's no emergency yet.
Nationwide, at last count, there were approximately 1,600 practicing nurse midwives. The program began at this medical center a little over a year ago with just one nurse midwife. Today, with 8 of them delivering 140 babies a month, there are still more requests for midwife services than they can handle. The attractions for nurse midwifery, as it is termed, are several-fold. Because the programs take only women without apparent complications, patients feel secure that theirs will be a normal, awake and aware delivery with little or no anesthesia and with the father present. However, because the program is in a hospital setting, emergencies can be dealt with.
Nurse midwives, we can manage the patient providing everything goes along as normal. Of course, you can never anticipate when a problem is going to arise. Therefore, there's a physician on the floor at all times who is available to intervene if a problem is anticipated or occurs, or to take over total management of the patient if it becomes necessary.
Excluding complications but including prenatal care, the typical nurse midwife delivery for a private patient at this county-run hospital is $1,000. That compares with about $1,700 using a private obstetrician at a private hospital. A patient here knows that once labor begins, her nurse midwife will be at her side. On request and when possible, the woman in labor remains in the so-called birthing room. For 21-year-old Elizabeth Davidson and her husband George, those were comforting thoughts.
They're always here when you want them. You know, they come around more often, you know, and stay with you and help you and things like that. I feel more comfortable with a woman.
Why do you like this better?
Because I can labor and deliver in the same room.
Less than an hour from the time of that interview, Elizabeth had her baby without complications. It was a healthy 7-pound, 4-ounce boy named Alex. Mother, father, baby, and midwife are doing just fine. Tomorrow night, a look at the medical technology available to detect pregnancy complications. Bob Mayer, Channel 4 News. Getting pregnant early in this century oftentimes meant dying. Things have changed dramatically, of course, since then, thanks to increasing medical knowledge and advancing technology. Even so, for every 100,000 deliveries today, 18 mothers will die. Most pregnancies, about 90%, are uncomplicated. And for the 10% which do develop complications, a wide variety of tests is available to determine the cause and to assist in finding a solution. The sonogram, or ultrasound test, is proliferating at a phenomenal rate in South Florida. High-frequency sound waves, which pose no known danger to humans, actually visualize the fetus on a black-and-white television monitor.
What we're first seeing here is an outline of the fetal head in a vertical scan, and as we keep moving upwards towards the upper part of the abdomen, we'll see a contour of the fetal trunk, within which we see the fetal heart beating. And as you can see,
ultrasound is used to determine the size and age of the fetus, whose growth can be monitored by repeated scans during pregnancy. Doctors can detect multiple pregnancies with ultrasound, can predict if a natural birth is possible, and in some cases can determine if the fetus is abnormal.
When it comes to genetic evaluation of the fetus, I feel that any woman who gets pregnant over the age of 35 should consult her physician to have further diagnostic procedures, specifically to rule out fetal Mongolism. The incidence of fetal Mongolism starts going up after the age of 35.
Amniocentesis, less routine because it does pose a risk to the fetus, can be used to rule out brain and spine defects as well as 50 or 60 other fetal metabolic disorders. Here, the physician inserts a large needle into the womb area and draws out a sample of the amniotic fluid in which the baby floats. When a high-risk mother is near to term, the color and thickness of the fluid may indicate that a cesarean section is necessary. Any so-called high-risk pregnancy patient should submit herself to a doctor early on for studies such as these. High-risk patients include any woman who has medical complications of any kind during pregnancy, but particularly diabetes, hypertension or high blood pressure, Rh disease, and women who have had previous complications during previous pregnancies. Not getting checked is a dangerous gamble.
Because these particular patients are ones who frequently end up with all kinds of complications, which were not identified earlier and perhaps taken care of.
What you're hearing is the actual sound of a fetal heartbeat, made audible by a bit of technology called a fetal monitor. Oftentimes used in conjunction with a stress test, the fetal monitor also provides a visual printout of the baby's heartbeat on the left and of uterine contractions on the right. In overdue pregnancies, this is another guide for the physician in deciding whether the delivery will be natural or by surgery. Special tests such as these and others, like fetal blood sampling, are expensive, of course, to the private patient, but far less expensive than the alternative.
When we come to doing them, when they have to be done, okay, they are extremely important. They're the difference between perhaps saving the life of a baby and not saving the life of a baby.
Tomorrow night, we will see how the life of a baby is saved as our cameras view a cesarean delivery. Bob Mayer, Channel 4 News. As we saw last night, technology has come into widespread use in determining whether a baby can safely be delivered naturally. If indications point to fetal distress prior to labor, or if a variety of other conditions exist, doctors are increasingly turning to the cesarean section or surgical removal of the baby. In the case of Maria Ortiz, obstetrician Dr. Richard Corson decided on a cesarean birth for several reasons. Risk for a natural delivery was increased because of her age, 35, because it was her first pregnancy, because her placenta was no longer providing enough oxygen to the fetus, and because her pelvis was simply too narrow. References to cesarean sections date back to ancient times, with the first recorded instance in the early 1500s. The actual procedure is now a simple one, although it is major surgery. A general anesthesia is usually used, and after the patient is unconscious, the doctor moves quickly to remove the baby, making an incision about 4 to 5 inches long in the lower portion of the abdomen.
Any close-up shot of the baby?
Second chorus, please. Clamp. Girl.
After the baby is removed, the cord is cut and her airway suctioned to facilitate breathing. Cesarean births have increased dramatically during just the last 10 years, rising from a national average of about 10% of deliveries to 20% today. Critics charge that greed, convenience, and a fear of malpractice suits are the reasons. Doctors argue that the increase in cesareans is due to their desire to prevent possible brain damage to infants when a natural birth is risky.
The mental capacity can be diminished in many ways during the course of a delivery. It is the shortest and yet the most dangerous trip any of us will or ever have made, merely because of the risks involved. We feel that it is incumbent upon us to deliver an individual as best we can in a fashion which will preserve whatever his potential may be. And many cesarean sections are done because we have more concern for the quality of the infant being delivered than merely whether it lives or dies.
While risks to the mother from cesarean sections, such as infection, still exist, they are in most cases easily and quickly dealt with through modern medications. However, most obstetricians agree that once a mother has one cesarean birth, additional births must also be by surgery because of the weakened uterine wall. It might not be the birth method of choice, but every woman who becomes pregnant must face the fact that a cesarean section is a possibility. While the national average is 2 in 10, the figure is much higher in certain areas. Tomorrow night, we will witness a natural birth where the mother is very much awake and very much aware. Bob Mayer, Channel 4 News.
Remember, when you get to the peak of the contraction, try not to breathe any faster than 1 breath per second. Right?
These mothers and fathers-to-be are attending a class in natural childbirth. They are part of a growing trend which is literally smashing years of tradition regarding the circumstances under which babies are born. Natural childbirth, or prepared childbirth as proponents like to call it, is accomplished without the use of a general anesthetic and with the father in the delivery room. Today, deliveries where the mother is awake and aware account for the majority of births in some hospitals where just 2 or 3 years ago there were none. In classes such as these, available to couples around the country, techniques are taught to deal with the pain, anxiety, and stress usually associated with having a baby. The Lamaze method being taught here is the most widely used.
Relax, okay? Try to relax as much as possible in between contractions, and don't ask the nurse or the doctor how much longer is it going to be or how many more times do I have to push. Just try to take each contraction one at a time.
For the mother, she's able to approach birth with less fear. She's able to participate in the birth process so that she is the one who delivers the baby. The emphasis is on the mother delivering the baby and not on the doctor delivering the baby. For the baby has less risk due to minimized medication. And I think the father admires the woman tremendously more because he sees that what the preparation has done and how much effort it takes to push the baby out. There's a tremendous sense of pride that comes from participating in the birth process together.
When the time finally came for 31-year-old Sandra Leader, she had been in labor only 2 hours and 16 minutes. Sandy and her husband Nathan already had 2 children, the last by the Lamaze method. So on this day, she made the entire procedure look like a cinch.
Okay, Sandy, hold on there. Hang in there just a little bit more. Push.
Okay, big breath and push down. Push. push, push, push. Push down, push, 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 push. Keep pushing, keep pushing. Keep pushing, Sandy. Come on, take a breath and push as hard as you can.
Okay. You don't have a redhead this time. Okay. One loose loop, and you got another boy. Oh, look at that fat little kid. Let me get him nice and cleaned out and clean his face off so we can see his smile. I'm going to get him on a tack here.
Oh, I did so good.
You did fantastic.
Oh, good.
Looks like his old man.
Oh, he's gorgeous.
You can touch him.
Oh, he looks like me.
He won't break.
What kind of an experience do you find it? You chickened out on the first one.
It's the greatest experience in the world. I wish I had. I mean, I wish I'd have seen all three of them being born. I mean,